Hi Amber, my name's Grace. I'm gonna be your nurse today. Welcome in. So, how are you? Is there anything that's bothering you right now?
Hi Nurse Grace. I'm actually not feeling too good. I was hoping that you could tell me what is wrong with me.
I'd love to help. Can you tell me what's bothering you? What kind of signs and symptoms you're experiencing right now?
I believe I have a fever. I have the chills, but I feel like I'm sweating. I've been having bloody diarrhea since last night and my stomach hurts super bad.
Well, we may want to run some tests to see what's causing the bloody diarrhea. Have you eaten anything recently that just did not taste right to you? Most times the food we eat is what gives us issues and causes us to have the bad diarrhea.
I drank a glass of milk yesterday morning at around 10 o'clock that had not yet expired, but it just did not taste normal. Other than that, I can't think of any other food or drink that could have been bad.
Okay, well, so that may be the issue. I want to take a stool sample and run some tests. I don't like that you're having dysentery, which is bloody diarrhea, and that you also have a fever. So could you please run to the bathrooms and take a stool sample?
Okay, I'm all done. Here you go.
Thank you, Amber. I'll take this to the lab, run a few tests, and return back in a few minutes. Let me know if you need anything while I'm gone.
Thank you.
Alright, I'm back. So, the test indicates that you have E. coli non-shiga toxin diarrhea. So, we looked at your tests. We found gram-negative bacteria that is lactose fermenting and beta homolytic on blood agar. So, the strains were unpigmented. When we tested for the shiga toxin, we found no sign of it. So because of this, we are positive that you have non-shiga toxin E. coli diarrhea.
I am very unfamiliar with that. What exactly does that mean?
Well, so most types of E. coli are harmless and normally live in the intestines of humans and animals. Some E. coli are pathogenic, and this term means that they can cause illnesses. It is normally transmitted through contaminated water or food, and it's categorized as a non-shiga toxin because it does not contain the shiga toxin. And this is a good thing. So if the shiga toxin were to enter into your bloodstream, it could cause kidney disease and other really serious threats. So luckily we don't have to worry about that, and we only have to worry about the diarrhea.
Okay, how do you think I came in contact with this infection?
I wouldn't be surprised if it had something to do with that glass of milk you drank yesterday morning. Unpasteurized milk is known for being contaminated with E. coli, as well as iceberg lettuce and some sausages. So if you notice something tasting a little weird, I'd advise you to stop eating or drinking it immediately, even if it is brand new, unopened, or like not yet past the expiration date. The only prevention to non-shiga toxin E. coli diarrhea is to avoid food and drink that is infected with it, and so overall just having like good food hygiene will help prevent it.
Okay, thank you for the advice. Is this infection serious? Do I have to worry about it in the future?
So luckily for you, this infection is mild. Your body will fight the infection, and with time it will go away on its own. The symptoms will probably last about like 5 to 10 days, and there are a number of ways to ease the symptoms while you wait for the infection to pass.
What tips do you have for me?
So it's important to stay hydrated. Diarrhea is known for causing dehydration, which will make you feel even worse. Drink plenty of water, electrolytes, and eat water-rich fruits and vegetables like watermelon, pineapple, bell peppers, broccoli, and celery. I also recommend anti-motility drugs. These are over-the-counter drugs that help relieve the symptoms of diarrhea.
Thank you so much for all of this information. I will stay hydrated, take some anti-motility drugs, and practice good food hygiene in the future. Is there anything else you recommend?
I have a packet for you that contains all this information in case you need a refresher on E. coli non-shiga toxin diarrhea. And here is the packet. I hope this information is helpful for you, and please call me if your symptoms do not alleviate within the next week, and I really appreciate you coming in.
Thank you so much for your time. I really appreciate it.
Of course.